بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is a short talk about basic panoramic radiography. What is panoramic radiograph? It is a panoramic dental X-ray of the upper and lower jaw, and it is two-dimensional view of half circle from ear to ear, and it is a form of focal plane tomography. And the indication of the panoramic radiography is showing the impacted lower wisdom teeth, displacement fracture of the mandible, and Stephanie defect, dendritic cyst, preoperative before wisdom teeth, and dental pain and before implants, and other diseases like developmental anomalies like cherubism, cleidocranial dysplasia, carcinoma of the jaw, and also to evaluate the TM joint, temporal mandibular joint, and trauma to the mandible also, and stones in the salivary glands. Let us see some example. This is the machine of the for dental panoramic X-ray. And before we started with the examples, let us see some errors causing of the abnormal of the dental X-rays. These of the errors may be due to movement, may be due to the tongue from ear rings, patient tilted either anteriorly or posteriorly, and or upward. And here we see the tongue is not in close to the palate, as we see here radiolucent space obscuring the roots of the maxillary incisors. Here, this is ghost from the ear rings, and here the patient is tilted too posteriorly. And here this is the shadow of the spine, and the patient is tilted more anteriorly, giving to the panoramic as V-shaped mandible. Here this is normal bone panorama. Here we see panoramic X-ray with impacted lower wisdom teeth, as we see here, and a restoration of the teeth here, as with metallic restoration amalgam. Here another patient with impacted left mandibular third molar teeth. Here another impacted wisdom teeth bilaterally on the left side and the right side. Here another patient with impacted teeth on the left side, and we have also here long stylohyoid ligament calcification, as we see here bilaterally. Here we see here lucent area around the teeth here, and this is dendritic cyst. Here another patient with lucent area unilocular on the left side of the mandible. This is due to keratocystic odontogenic tumor, and the CT scan is here. The CT scan of the same patient, bony destruction and soft tissue swelling, as we see here. Here another patient with chirurgism, aggressive chirurgism, as we see here bilateral lesion involving the mandible, body, and the ramus and coronoid process of the mandible bilaterally, and the CT scan, 3D CT scan of this patient with multiple depression and bilateral vestibular cortical bone retromolar region. Also here, the same patient with multiple lucent area with bone destruction and cortical destruction, multilocular involving the mandible and the ramus, angle of the mandible and the ramus in this patient with aggressive chirurgism. Here a patient with fracture of the with minimal displacement of the right side of the mandible. As we see here, this is the tooth filling nerve root treatment. And here we see multiple fibrillars on overlying the mandible due to hemangioma. And here we see multiple stones in the submandibular gland canal, and also stones in the parotid gland, and restoration of the teeth with multiple nerve root treatment. Thank you very much for listening, and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.